Hello everybody. So in today's video, we're going to be discussing pressure and how pressure affects your lungs and your breathing. To do that, we're going to have to go all the way back to the nightmare that is currently 8th grade physical science. Some of you may have learned this in other physical science classes, others it may have been physics, depending upon your age or where you went to high school. I know what I'm talking about may bring some truly dark memories back to you, but please bear with me here. We're going to get through it. It'll be okay. We just have to talk about this a little bit, and y'all have to understand it. So the first two objectives today, and yes, I realize that we're going out of order a little bit with your objectives, the ones that I have listed for your video titles. Today's objectives in this video are going to be objectives 7, 8, 9, 10, and 14. However, the first two we are going to talk about are objectives 8 and 14 because those objectives purely state, discuss the and apply Boyle's law to the process of inspiration and expiration. And objective 14 says, explain Dalton's law of partial pressures and Henry's law, including how they apply to respiration. And we can't actually discuss those laws until I tell you what they are. So the first thing we're going to talk about is pressure and define your gas laws that were basic gas laws that they teach in chemistry classes and physics. And then we can talk about how they apply to your lungs and breathing. But we got to know what your gas laws are first, right? Remember from your last video where we left off when we were talking about your pleural cavity, right? We have a few different pressures that we have to take into account here. We have atmospheric pressure, which is the pressure of the air that's around your body. That would be at atmospheric pressure or at 750 millimeters mercury, which is how pressure is measured. If you are at sea level, right? Then we have your intra-alveolar pressure, which can also be called your intrapulmonary pressure. That's the pressure inside the alveoli, inside the tubes in your lungs. That pressure is always supposed to equal atmospheric pressure. And then you have the intrapleural pressure, which is the pressure inside the pleural cavity, which is always supposed to be negative or lower than atmospheric pressure. So you are always going to want your intrapleural pressure to be lower than both of the other two, your atmospheric and your intraalveolar. Right? To get into this, we're going to have to discuss a couple of gas laws. Right? And the first gas law that you guys are going to know about is from Objective 8, which is discuss and apply Boyle's law to the process of inspiration and expiration. Well, we can't do that if we don't even know what Boyle's law is. Right? So, Boyle's law. Right? Boyle's law has to do with the relationship between pressure and volume. So we're talking about gases, and Boyle's law is about the relationship between pressure of the gas and the volume of the gas. And Boyle's law basically states that pressure varies inversely with volume. Right? The fancy mathematical, like pressure inversely proportional to volume. Your fancy mathematical way of putting this is the pressure of sample 1 times the volume of sample 1 equals pressure of sample 2 times the volume of sample 2. This is your fancy mathematical formula for that, but we're not going to get too terribly much into that. Basically, if we want to boil down all of that math speak and talk about just cause and effect of their relationship, Boyle's law means that as pressure goes up, volume goes down, and as volume goes up, pressure goes down. Right? So, once again, think of this lovely little mechanism here, right? So, if you have lots of volume and space for volume, like these little molecules here, so you have lots of volume, that means you're not going to have very much pressure. But then when you squeeze it down and make the volume smaller, see these air molecules are just bouncing around closer together? The smaller the volume, the less space they have to bounce, so the pressure is going to increase. So you have as volume increases, pressure decreases, right? If you want to think about this, think about Boyle's law in terms of your anxiety and social gatherings, right? The more space you as a person have, the less pressure and anxiety you feel. But if you are suddenly put into a very small space and it feels crowded, your space has gone down, but your anxiety goes up. The pressure you feel goes up. That is Boyle's law. And it's just thinking about gases instead of your anxiety levels in social situations. Right? So that's what Boyle's law is. We also have to talk about gas laws and air composition for what we're breathing in. Because we all know that none of us are purely breathing in oxygen. That would actually burn and hurt us a little bit. It would feel like burn. Which brings us to the other two gas laws that we have to know about in order to fully discuss this. That would be objective number 14, explain Dalton's law of partial pressures, and Henry's law, including how they apply to respiration. Right? So partial pressure, if you don't remember from chemistry, or even if you haven't had chemistry yet, that's okay. Partial pressure is the pressure exerted by a type of gas in your mixture. So when we start talking about partial pressures within atmospheric pressure, we're talking about the pressure that, like, the oxygen in the air that's all around us is. So here's your image of that. We all know that what we are breathing in is a mixture of gases, and it has a lot of oxygen and nitrogen in it. So oxygen within the air that we're breathing around has a pressure. In this sample right here in your picture, that pressure is 159. Once again, you also have a pressure of nitrogen in the air that's around you for atmospheric pressure. In your image here, the pressure of nitrogen is 593. So we can look at the partial pressures of a total system if we really need to. Total pressure is going to be the sum of all partial pressures. So that means if we wanted the total pressure of the air that we're breathing in, and the air is made out of oxygen and nitrogen, if we know that the partial pressure of oxygen was 159 and the partial pressure of nitrogen is 593, then our total pressure of oxygen and nitrogen would be 752. Right? This brings us to Dalton's law. Dalton's law basically says the total pressure exerted by a mixture of gases is the sum of all of the pressures exerted by each gas. So that means Dalton's law is simply total pressure equals all partial pressures added together. So the partial pressure of each gas is directly proportional to the percentage in that mixture of gas. An example of this would be like the partial pressure of oxygen in your lungs right now that you have breathed in is in proportion to the percentage of oxygen that you have breathed in. So the pressure of oxygen within your lungs, which is what we want to breathe and what is good for our body, is proportional to the percentage of oxygen that was available in the air that we breathe. This means Dalton's law can come very much into effect for various specific sort of circumstances. This is why mountain climbers who are trying to get up Everest, for example, carry like containers of oxygen, because the higher altitude you go, the higher above sea level you are, the less oxygen in the air. That means the less partial pressure oxygen will have with the air you're breathing in, and hikers at that altitude they will need an oxygen supplement, because the pressure of oxygen in their lungs, if they were just breathing openly in the air, would be lower than if they were at sea level, because Dalton's law tells us that the two are proportional. Right? Henry's law sort of piggybacks off of Dalton's law, and it says that when a mixture of gases is in contact with a liquid, right? Each gas is going to dissolve into the liquid in proportion to its partial pressure. So that means at equilibrium, the partial pressures of your two phases between liquid and gas are going to be equal, and the amount of gas that will dissolve in the liquid also depends upon its solubility. Right? So once again, Henry's law is the concentration of gas in a liquid is directly proportional to solubility and partial pressures. I know that seems sort of weird, but we are indeed trying to transfer gases that we breathe in to a liquid, which is our blood. That is the entire purpose of your respiratory system. So Henry's law can very much affect some things. Bear in mind, like my example if we were climbing Everest that I was just talking about, oxygen has a lower partial pressure because there's less of it in the atmosphere at higher altitudes. That means that because the partial pressure of oxygen is going to be lower in your lungs because there's less oxygen to have, oxygen transferring into your bloodstream is going to do that less because of Henry's law. Because transfer of gases is proportional to between liquid and gas. And if you have less oxygen, there's going to be less transfer of that oxygen from air to bloodstream, which is not good. You want oxygen. You want that to bind to your red blood cells and be carried on. We have talked about your red blood cells before in your blood unit, right? Some quirks to this process, though, that are hang-ups on Henry's law that can get very frustrating when we start talking about all of this, especially when you get into the chemistry of it. Carbon dioxide is about 20 times more soluble in water than oxygen is, right? This is one reason why out in nature, the oceans, when we start talking about ecology, are very good carbon dioxide sinks. They hold on to a lot of carbon dioxide. Also, we need to bear in mind that even though nitrogen is a decent chunk of the air we breathe in and out, because nitrogen is a large percentage of the gas that we breathe, nitrogen does not dissolve readily in water. Very little nitrogen is going to dissolve readily in water. So that means a lot of the air we actually breathe in and breathe out, because it's nitrogen, does us absolutely no good because it's not going to transfer into our bloodstream, right? Your respiratory system's functionality is based entirely on pressure and these three laws. So how well your respiratory system can work is entirely based upon these three laws. Henry's law telling you that gas exchange between air and blood is dependent upon gas percentages and pressures. Dalton's law telling you that the pressure that a gas can exert is in direct proportion to the percentage of that gas in the air you're breathing, right? And then Boyle's law telling you that the more you breathe in, so as volume increases, pressure decreases, but as volume decreases, pressure increases, right? So we have mechanisms via Boyle's law to either increase or lower pressure of air within us. But that pressure, the partial pressures that Dalton's law talks about, is going to depend upon how much oxygen we've breathed in and what our body can do with it. And Henry's law is going to determine how much of that oxygen we can actually absorb. Right? So breathing requires changes in air volumes coming in when your body controls with your pleural pressures. And how well your blood absorbs oxygen to get rid of carbon dioxide is based on Henry's law, which is controlled by Dalton's law. So the actual breathing mechanism is Boyle's law, or is how our bodies control Boyle's law inside us. And then that gas exchange between air and blood supply is Henry's law, and Henry's law is controlled by Dalton's law. Bear all of that in mind as we are talking about this, because we have to continue talking about pressures and that sort of thing. right? This is going to bring us to Objective 7. Explain why partial volume in the intrapleural space is so important. So we need to know why these volumes are important in the first place. This is Objective 7. Objective 9 is to discuss how respiratory muscles and your lung elasticity produce these volume changes from Boyle's law that cause air to flow in and out of the lungs. And objective number 10 is describe the physical factors that influence pulmonary ventilation. So we need to talk about some physical aspects that will influence your pulmonary ventilation and abilities to take air in and out of you. Right? And before we can really get into this, we have to go over a couple of simple definitions first. So you've heard me say inspiration and expiration. Those are your fancy terms for breathing in and breathing out for this unit. Inspiration is simply breathing in. Inspiration, so you know, is an active process. That means your body has to actively do it, and it takes energy to breathe in. Your muscles are going to contract as you breathe in. Your thoracic volume is going to increase. That means pressure inside the lungs is going to drop to about -1 millimeters Hg. So this is like pulling on a balloon, poking and pulling the plastic and latex around a balloon that is controlling your lungs, guys. When we breathe in, we pull on the lungs, and that's going to lower the pressure inside the lungs. When we breathe out or expire, right? Expiration is breathing out. That is a passive process most of the time. You can control, most of the time when you're not thinking about it, expiration is just your muscles relaxing. It's a passive process, no thought required. Nothing actually has to move, only relax for you to do it. That does not mean that expiration has to be a passive process, though. You can control how well you breathe out. People who play musical instruments or sports can control their breathing very well, especially those who swim. We'll get into that a little bit later, but expiration is most of the time a passive process, although it can be active. Inspiration is always active. It always requires muscles to do a job to breathe in. Right? But expiration is most of the time passive, and it requires your muscles to relax. When your muscles relax, that means your thoracic volume is going to decrease because it's going to shrink your thoracic cavity space a little bit. The pressure inside your lungs then is going to rise up to about +1 millimeters mercury. So that means as you breathe in and out, your intraalveolar pressure is going to waver between +1 and -1, back and forth, right? And we already know how your pressures for your lungs are supposed to be. You have atmospheric pressure being breathed in that's outside your body. Your body, this intraalveolar pressure, wants to be atmospheric pressure. But this lovely pleural cavity here is negative. It has a negative vacuumed pressure of around -4, right? So your intrapleural pressure is a -4 millimeters mercury. And your body takes advantage of that as you breathe in and out to change the pressure in here, which will force air to either rush in or rush out. Right? So, when we're talking about actually breathing, right, this is a picture for this, right? When we are breathing, right, your diaphragm is going to contract. And remember that diaphragm is that muscle that separates your abdominal cavity and your thoracic cavity, right? It's the one that just goes at the bottom of all of your ribs across your whole body. When you are breathing in or inspiring, your diaphragm is actually going to contract. And when it contracts, it pulls downwards. So it's going to look more like this. right? So your diaphragm contracts and pulls downwards. That's going to pull the bottom of your lungs that are sitting on top of it down as well, and it's going to stretch them like a balloon, like you're pulling on the bottom of a balloon, right? The intercostal muscles, which were the muscles between each of your ribs, are going to, as well as your abdominals, which are abs here, right? Those are the ab muscles there, are going to stretch and contract to make room for your enlarged lungs. This is why when you breathe in deeply, you can see somebody's chest move outwards and get bigger, right? Doing that, because you are pulling the lungs to be bigger from all directions, is like pulling on a loose balloon from the bottom and the sides. That's going to lower the pressure inside your lungs, which is going to suck air into them so that it can all even out. Because the volume can go up. By increasing the size of the lungs when you contracted your diaphragm and pulled it down, you have made the volume in your lungs go up, right? That means you have more space in your lungs. And remember, things want to even out with atmospheric pressure. That's going to pull air into it in accordance with Boyle's law, right? When you are breathing out, when you expire, right, you're going to relax these muscles. Your diaphragm relax and bows upwards once again. So you can see the difference between contracted diaphragm here and relaxed diaphragm that just relaxes and pushes the lungs back up, essentially. When you're breathing out, those muscles are going to relax, and that's going to make your abdominals and your intercostal muscles also relax, right? Meaning there's even less space in your lungs. Because of that, pressure in your lungs just went up because you lowered the amount of space in your lungs, and your body wants to even out with atmospheric pressure. So that pushes air out of your lungs and out of your mouth to even out with atmospheric pressure. That's the entire goal of breathing, because things like to be at equilibrium. The inside of your lungs want to be equal with atmospheric pressure. So when you inspire, or during inspiration, your diaphragm will contract, your abdominals and the intercostal muscles will stretch out and make room for larger lungs. That increases the volume, which will lower the pressure of gas in there to -1 to even out with atmospheric pressure. Air is going to come rushing into your lungs. Then when you breathe out, or during expiration, you relax your diaphragm. That's going to push your diaphragm up. Relaxing your abdominals and intercostal muscles as well is going to shrink that space. Space shrunk, pressure went up to a +1. That's going to push air out of your lungs because your body wants to be even with everything in the world around it, or the air wants to be equal and at equilibrium. That is how we breathe and what controls our breathing. Basically, we control Boyle's law within us using the pressures of our lung to make our body breathe. The more your lungs can expand, the more air your lungs can hold. That makes sense, right? The bigger the balloon is, the more air it can hold. The more elastic your lungs are, so the more your lungs can stretch, the more they can stretch and expand. So the more elastic your lungs are, the more they can stretch out and expand, meaning the bigger they can get and the more air they can hold, right? Right. So there are some physical factors that will affect this, because like we just said, the more you can breathe in, or the bigger your lungs can expand, and the stretchier they are to expand bigger, the more air they can hold and the better your breathing is going to be, right? This gets into a couple of interesting quirks for breathing, right? And some things that will inhibit your ability to breathe, right? Because you have to talk about resistance to your airways and passageways, right? Because if something is blocking the passageway, you can't breathe. That's an obstructed airway. Air can't get in, and that's not good. Right? So we need to talk about some things that will affect this and how easily you can expand and contract your lungs and how well this will work, right? So there are going to be some disorders or environmental factors and habits that are going to prevent your lungs from being able to stretch and will inhibit your breathing. They will cause resistance. It will block pathways, right? The biggest one that most of you guys have probably seen before is asthma, right? So there are a decent number of things to think about here, right? Asthma is the main one. So you see a partial image, right? So this is a normal open airway. You can see how wide that airway is. Someone with asthma, their airway may be a little bit more closed off. During an asthma attack, it's going to close off further because these muscles will close it. Asthma is basically the bronchi. Remember those bronchial tubes that go into your lungs? And even the smaller ones, the bronchioles, typically are swollen and they cannot stretch any further than they already do. So with asthma, those bronchioles and bronchi are swollen and they're not able to stretch very well. Because they're swollen, that means the air passageway in it is more narrow. So there is a narrow air passageway. That means there's less space for the air to pass through the tubes into the lungs in the first place. And that's going to prevent some breathing, right? During an asthma attack, because there's less stretch and less everything else, things may become more swollen and constrict further. That's going to hinder the airway and the air passageway, right? You can't breathe like that. Some things help widen your airways, right? We know some of the stuff that will help widen the airways. Steroids often help open up airways. So there are a decent number of them that are readily available treatments for asthma patients in something like an inhaler, right? So most inhalers come with a steroid medication that's prescription-based in it. You put them if you've never used an inhaler before or didn't know how they work, you put the inhaler right here up to your mouth, you put your lips over it, and you push the medication jar down while you breathe in. So you are taking a breath in, and as you breathe in, the steroid mist of medication you just inhales down your bronchial tubes. And then it's in direct contact with your bronchial tubes. And that helps, the steroids will help the swelling go down there. That way you can breathe, right? Asthma, though, can be caused by any number of things, right? It can be caused seasonally. It can be caused by allergies. There can be triggers to your asthma like mold or dust. Some people have exercise-induced asthma, so you'll have an asthma attack if you try to jog, but you're fine just sitting in the Polleny, Georgia sun in the springtime. It just depends. Different people's bodies react differently to different things. Asthma can be triggered by a number of things, right? Other impairments that can hurt your ability to breathe in and out and your lungs' ability to stretch, right? Scar tissues, right? Scar tissue, as we've covered in other things, cannot expand. It's not flexible. That's why it's scar tissue and not the actual bodily tissue that it replaced. Scar tissue can be caused by any number of things. It can be caused by smoking, chronic bronchitis, fibrosis, any illnesses. They are particularly, right now in the world that we live in, we are particularly worried about scar tissue from things like COVID, right? That is a leading concern for why this is a health worry right now. Scar tissue does not stretch because it's not flexible. We all know that already. So that means most scar tissue, the more scar tissue somebody has in their lungs, the less flexible their lungs are going to be. So the less they will be able to stretch and breathe in, and that's going to affect breathing tremendously. Right? Some deformities and disorders that some people have can also affect your breathing. If an individual has a disorder that prevents normal motion in your thoracic cavity, like scoliosis, if your back is extremely twisted, to the point where it is making your thoracic cavity smaller and less flexible, so your lungs have less space, you're not going to be able to breathe in deeply anymore, right? If you have arthritis in your rib joints or your intercostal joints, that's going to hurt, and then you won't be, if those joints are stiffened, you won't be able to breathe very well, right? If someone cannot puff up their chest and straighten up their back with whatever disorder or disease they have, it will impact their lungs' ability to expand and how much air they can actually take into their body. So any number of accidents, deformities, or disorders could cause that kind of thing, right? Paralysis is something we need to talk about as well, right? Remember, you had one big muscle that controlled most of this show, your diaphragm. So paralysis is super important, right? Should your intercostal muscles or diaphragm become paralyzed, your lungs will not be able to expand and the individual will not be able to breathe. This is why botulism poisoning was so terrifying back in the day and why it's so bad now. Because botulism happens to be a bacteria that can live without oxygen. So it is one of the few bacteria that can live in canned goods after we have canned them to preserve food out of season. This is why there are those little bitty pop tops on the top of the cans that we buy in the grocery store, and you're supposed to check, like, if you're at the grocery store and you pick up, like, I don't know, some jelly to put on your peanut butter and jelly sandwich, and you hit the top of the jelly jar and its little pop tab is already popped and it can go pop, pop, pop on the top of it, it's not sealed. Botulism is growing in there. Tell a manager or just discard that jar of jelly. It's bad and can kill someone. Don't buy it. Don't eat from it. Don't touch it. That is especially important to know if you are one of my fellow canners that enjoy canning like fresh garden vegetables or making your own jam and jelly at home. Like, always check the little pop tops of cans you have not opened yet after you've canned things in your mason jars, because that means the seal either wasn't good and it didn't take, or it was infected with botulism and you cannot eat that. Don't risk that. Don't go to the hospital. But a side effect of botulism in those cans is paralysis, because botulism will paralyze your muscles and it will cause paralysis in your diaphragm, and then you will not be able to breathe. If you don't have these muscles, you can't breathe. You will essentially suffocate. Right? So paralysis is important to think about here, right? Right. So this is another reason why pressure is important, because pressure in the pleural cavity is important. Or another thing to remember, pressure in your pleural cavity is important. If that pressure difference is not maintained at a constant negative, your lungs and that pleural cavity will all even out with each other, because remember, because of diffusion and osmosis and everything else, things like to find an equilibrium, right? So pressure is super important, and if that pressure is not maintained, the lungs are going to find an equilibrium with atmospheric pressure. If the pleural cavity reaches equilibrium and stays there, with atmospheric pressure, your lungs cannot expand, and you will not bring any air in. So the best way to think about what I'm talking about now is a balloon, right? Think about a balloon. When you blow into a balloon, you're increasing the air volume in it and lowering the air pressure. When you open up the balloon and air rushes out, right? When the air inside the balloon is equal to the air outside of the balloon is flat. You don't feel any air moving in and out of that balloon anymore, right? Your lungs will do the same thing if pressure is not maintained. So if you don't maintain that pressure from the pleural cavity, your lungs will deflate like balloons, essentially. right? Your fancy term for a collapsed lung collapse due to pressure failure, is atelectasis. It's this weird-looking word right here, Atelectasis, right? That is a collapsed lung. Basically, that is caused because something, whatever it is, I don't know what it was, it could be any number of things, but something was throwing off the pressure in your lungs. An example of this would be like a car accident or an injury that would poke a hole in your lung and let fluid or air into your lung. It could be caused by the bronchi or bronchioles becoming completely blocked off, as though you tied an air balloon off, right? Which can happen if you have a really bad infection, or it can happen with tar buildup from smokers, that kind of thing. Which would cause the lungs to inevitably collapse when your muscles try to stretch them. You don't want blocked little bitty bronchial pathways, because if that happens and you keep trying to stretch the balloon will pop, and that causes your lung to collapse. It's not good. A couple of things here that are fun additions to a collapsed lung, right, is if you have a pneumothorax. A pneumothorax is when air in your pleural cavity is what collapsed the lungs. So whatever happened in that accident caused air to get into your pleural cavity. Maybe something really bad happened and you tackled somebody too hard in a football game, and it caused that pleural cavity and the two layers of pleura that you had to tear apart from one another slightly too much. Like, that can happen if air gets into that pleural cavity, right? That can throw off the pressure and cause that part of your lung or your full lung to collapse, right? A hemothorax is when blood or a different bodily fluid gets into your pleural cavity and is causing your lung to collapse because that area is filling with blood. So maybe you got into a very bad car accident and a broken rib chip poked your pleural cavity, and now you are slowly bleeding into your pleural cavity from that car accident. That can cause that lung on that side of your body to inevitably collapse if your pleural cavity is filling with blood, right? That's called a hemothorax. And one thing that wasn't on your PowerPoint that I'd also like to talk about, because we do have a number of first responders in our classes, temperature can also affect volume as well. So temperature of the gas can also affect the volume of the gases. You have a whole other set of gas laws that we haven't gone over, because Boyle's law was like one of 4 that we have to go over in 8th grade classrooms. You didn't have to know the other ones because they didn't affect you very much. But there was one of them called Guy-Lussac's law, right? And that's the one that basically controls how pressure cookers work. If you cook with pressure cookers at your house, that gas law states that as temperatures rise, so does volume. And so temperature and volume both go up at the same time, or temperature and volume both go down at the same time, right? This is how pressure cookers work. But this also is something that first responders may need to be aware of, especially if we're talking about firefighters, because if someone inhales hot smoke during a house fire, because of that sudden change in temperature, if the heat is too much for your nasal cavity and everything else to adjust as quickly as you are breathing, because of that sudden change in temperature, the air inside your lungs, you're changing the volume of the air inside your lungs with that temperature change as you're breathing in. So the air inside your lungs volume can change, and that can cause a person's lungs to collapse. A very sad truth that firefighters and some first responders learn is that what normally kills people in a house fire is not actually being burned and burning from the flames. What normally kills an individual in a house fire it's not the flames themselves, it's the temperature of the hot air around them, because the air got too hot, and when that person breathed in, it was too much for their lungs, and it caused the high Like the temperature that raised caused the volume to go up in their lungs, and it burst some things and caused their lung to collapse. And at that point in time, if you are in a burning building and then your lungs suddenly collapse because it was too hot, you don't have the ability to breathe, to exercise, to pull yourself out of there, because running away from the fire takes muscles and exercise and time, right? This is something that firefighters and EMTs will likely be aware of that other people won't be. If you breathe in hot air that is too hot in a house fire, it can suffocate you by collapsing your lungs. Right? So this is something to be aware of for our first responding crew in class. Right? But I believe I have bothered you guys enough with this video. We got to talk about a couple of clinical things, and we talked a lot about pressure and how pressure affects your breathing. If you have any questions, please let me know. I will see you guys later. Have a wonderful, wonderful day.